Hi, listeners. Welcome back to the Deep Sea Foundation educational channel. Our conversation today is to educate, to inform, and provide resources to those affected by breast cancer. They often inquire about a tattoo, either decorative or a 3D nipple areola tattoo, as part of their post-surgical treatment. Our focus in the interview today is to provide pathways to access and care. I'm really pleased to be joined by a returning guest. I interviewed her in 2019, which I cannot believe. And I introduced her then as Christina Johnson Seigel of Living Story Tattoo. Christina, that video has had 5,000 views. So you can imagine, I was excited to have you back on
Oh
the
my
show.
gosh,
Yes,
it's
amazing.
crazy.
I looked that up yesterday. But now I can introduce you because you are also known as Christina Johnson Seigel, the Nipple Fairy.
I
Yeah.
am.
The Nipple Fairy. I love the one because I see that on your social media links and so forth.
Yeah,
So
I have them
I'm
all over my office.
I bet you do. So I'm super excited to have you back on the program because we have a lot more to chat about today since I interviewed you in 2019. Um, why don't you just start, Christina? Welcome back, by the way.
Oh, thanks.
Uh,
Thanks for having me back.
Yeah, it's good to see you. Why don't you start out, Christina? I'd like for you to just introduce yourself and speak to us about your background training and what you're doing for those affected by breast cancer.
So, I'm a registered nurse, even though I don't really have a traditional nursing job anymore. I
Mhm.
got my bachelor's of science in nursing in 1996, and for about 10, 11 years, I worked in the hospital in like the burn unit and the NICU, and then I segued into oncology and eventually into the plastic surgery reconstructive office at Ohio State. And I worked there for about 9 years. And that was where I was introduced into the idea of nipple tattooing. And we provided that service at the office. It really wasn't a very permanent solution for nipple tattooing. It was very similar to what most of the physician offices in the country and even globally were doing at the time.
Mhm.
And I wanted to pursue a career that would be more of a realistic look, more of a permanent solution, and just really a beautiful result that a survivor deserved. And when Dr. Kochek and Dr. Tawari opened up Midwest Breast, they had a need for their patient. They recognized that need and they approached me about seeing if I really wanted to jump in and actually do it, because I'd been talking about it for a while, but I never really made the jump. And so they said, "Hey, we have ladies that need nipples, and if you want to be the girl to put them back on, we'll send you all our ladies." And I just love them so much because if it wasn't for them, I wouldn't be doing this today.
Yeah, I'm going to give a shout out to them, Christina, because I've really been trying to promote the two-surgeon model or the co-surgeon model in microsurgical reconstruction. And Doctors Kochek and Tawari are two of those surgeons. They work with Dr. Kale also up at Midwest Breast. So I'm just going to give them a shout out, mostly for patients to know about surgeons who practice the co-surgeon model because we know that it really improves patient safety and outcomes. So a little
Absolutely.
little name dropping today. I'm glad you brought them up though.
I love that. Yeah, the dual surgeon approach. I mean, it
Hmm.
cuts down your time in the OR. You've got extra set of expertise and eyes and hands right there, and it's just such a brilliant way to run your practice,
Yeah,
because you have the best wants and needs for your patients in mind, and I love that they do that too.
yeah. Well, tell us
Yeah,
how you kind of honed your practice because you talked about your beginnings and what your
yeah,
aspirations were, and you started researching. Tell us how you honed your practice,
yeah.
Chrissy.
So originally, when I did tattoo training, apprenticeship style training, right? With a friend of mine, and he's a body tattoo artist here in town. And he basically had helped me break some really bad habits that I had developed as a nurse tattooing for so long.
Mhm.
And I had to like retrain my hand and learn the proper way to tattoo. And he really helped my drawing come along. And I just learned basically needles and fundamentals and all about a whole new world of inks that I was not familiar with. And he took me so far, and then he's like, okay, this is what I can do, but you need to go seek and find out somebody that has, nipple experience. And so I went out to Rochester, New York, and I trained with a gal named TJ Dill in 2015. And then I opened my practice after I completed all that training. I definitely think that my work has evolved over the last 9 years when I opened my business. The nipples that I were doing back then were definitely better than what I had been doing in the office setting, in the medical practice office setting. They were a good, solid foundation of a nipple. But now, just you learn and you get so many pearls of wisdom from friends along the way that do this. We share with each other. We don't gatekeep and keep everything private and secret. We share things. And my work has just evolved so far. And I love, I love watching how I've evolved. But you have to always keep drawing. You have to always keep practicing and trying and staying up on that.
That's what I've heard from several medical tattoo artists, some
Mhm.
that you and I both know, together, uh,
Yep.
is the drawing. And I'm noticing the beautiful drawing behind you there. Tell us how
Yeah.
that's important in your work.
So, in my opinion, and I think pretty much all of the people that I'm close to in the medical tattoo community, we all pretty much feel the same thing. As far as, if you cannot produce a 3D nipple tattoo in a realistic fashion, artistically on a piece of paper or a canvas with any medium, you should
Hmm.
never be attempting to try to put a 3D nipple tattoo on a survivor's skin using needles and ink. It's irresponsible, and it's not the right thing to do for those ladies. So ultimately, we are collectively trying to raise the standards for breast cancer tattooing for ladies to get deserving results for their breast reconstruction. Um, with I'm a part of a group, and it's called the Alliance of Medical Tattooing, and it's the AMT for short. And we're a nonprofit organization that it's a collective group of artists and other professionals that have come together to try to elevate those standards and really have, like, I don't want to say maybe guidelines, but like
Yes.
structure for what a medical tattoo artist should encompass, for as far as their, maybe their training, their work,
Mm.
what their portfolio has, to, as far as like, experience, I guess is the word I'm looking for.
Yeah. Yeah.
Yeah.
Yes. And I think, so we're going to put, here's, what I talked about at the beginning, pathways to resources. I will put a link to that so that, uh, those listening can find the AMT, because I think it's an important resource. Uh, I'm sorry, MTA. Did I say the letters correctly? It's
Uh, AMT.
AMT. Yeah. I have it on my paper and I'm like, no, that is not right.
Yeah, yeah,
AMT,
yeah, yeah,
AMT,
AMT.
Alliance.
Hmm.
I like that word, medical tattoo artist. All right. So, um, what I'd like for you to talk about, you mentioned something a minute ago because I asked you about drawing, Chrissy.
Mm-mm.
And you said something, you said you need to be able to draw on a canvas or any type of paper so that you know how to reproduce that on the skin of a breast cancer patient or those affected by breast cancer. It could be those at high risk that have also had reconstruction. But what is important is that skin component.
Yeah.
So
Absolutely.
much to know about there. Can you speak to us about that?
Yes. So the canvas, so to speak, that a medical tattoo artist is working on is definitely compromised. That skin
Mhm.
is extremely fragile. It's composed of scar tissue. Some of the scars can be thickened and elevated. Some of them can be atrophic and kind of very, very thin. Those two scars can be right next to each other. The skin may be radiated from the adjunctive cancer treatment that she may have had.
Mhm.
Radiated tissue is a whole nother beast. It acts very, very different than what healthy tissue acts like. So it's very important that you treat that with caution.
Mhm.
Um, but the whole skin or canvas, if you want to call it that, is unlike healthy skin in every possible way. And as far as tattooing that skin, you have to approach it with a knowledge base,
Mhm.
and you have to approach it in a cautious manner. Because if you are cavalier about this type of work, and maybe you take a 2-day class or an online class or whatever, and then you're like, oh my gosh, and you have good intentions in your heart, you're like, oh my gosh, I want to go out and I want to help survivors, and I want to touch as many lives as I can and make people feel better about themselves, but you don't know the critical components of that tissue,
Mhm.
then you could do damage to them. And ultimately, that's what nobody wants to do. Nobody wants to damage a survivor because they've been through so much before they walk through your door.
Mhm.
And that's the really the critical part of it.
Yeah. And why I want to put the AMT resource on this description, whether we have it for a podcast or YouTube, that will be both. I want people to know about that because in the setting of looking for a reconstructive surgeon, we do our research, we do our due diligence to find the best we
Mhm.
can. And I personally feel that that's what AMT is doing now, is like you said, trying to elevate that um, talent and skill and experience of a medical tattoo artist. So let's talk quickly, Chrissy. You've touched on the skill level and everything, but this is an emotional experience for patients.
Yeah, it is.
Talk to us about if you were going to give some advice to someone who's thinking about entering into this space, what does it have to look like in the office when a patient comes in?
So ideally, you want to have a private, quiet, serene setting for your tattooing. It needs to be a very safe place because this is an intimate form of tattooing. Patients are very vulnerable when they come in, not just physically, where they're exposing their body to you, a complete stranger, but it's an emotional vulnerability too. I tattoo out of 4 different locations, and 3 of them are cancer centers, and one is this is my office at Midwest Breast. So this is my room, and I try to make it as cozy and fun and non-medical as I can. But in the cancer centers, I'm in a traditional room in their facility. It's very, very clean, and it's set up with all of the things that I need. But sometimes just walking through the door of that cancer center can be a triggering kind of an event that
Yeah,
brings back a whole flood of emotions for a lady. And
yeah,
you may not even be like cognizant of it when it's happening. But then when you get in the room with me, and I'm having you undress. We go over to the mirror. We look at critical things, and we talk about all these details and things that at home you're not forced to address, right?
yeah,
And
yeah,
and it can be very anxiety provoking because you're kind of making these game day decisions. But the location. Sometimes ladies are like, oh my gosh, I know the cancer center. That's where I see Dr. So and so, and I know where to park, and it's close to my house or whatever, and I totally want to go there. And other ladies are like, please do not make me go there. I got the worst news of my life there. I had to go there and get my treatments, and I don't want to go back there. So then I have this office that is away from all of those centers, which
mhm,
can accommodate that.
yeah, options.
Mhm.
Honestly, when I think about it, and I'm basing this on my own experience, you go into a doctor's office for your reconstructive consult, and there is a lot of the same type of emotional feeling, I think, because you have to disrobe, it's hands-on skin. But for a medical tattoo artist, you guys really are touching these patients longer, and for, a different type of intimate experience. So I can
Yeah,
see where you have to be very cognizant of the whole
yeah,
emotional experience that
absolutely.
yeah, that they're
And
going
you're
through.
right. You're right. Your surgeon has probably laid hands on you for a much longer extended period of time, but you were not awake. You didn't actually experience that. But then here
Yes.
with us, you're exposed, you're vulnerable, and we are. So it can be really it brings the emotions out. I don't know how to
Yeah.
say it any other way.
Yeah,
But
and
I
and
think
varied from
yeah,
patient to patient.
yes. It can be like super over, like just this joy that happens and happy tears. And sometimes people are like, oh my gosh, it's shocking because they haven't seen nipples in so very long and they're just trying to process everything they're seeing and taking that all in. And those are the ladies who are like kind of like this. And then later at night, I get a text message from them where they're like, I feel so beautiful. So it just takes a little while, right? But everybody
Yeah,
has a different reaction.
yeah,
And it's lovely for us as medical tattoo artists to be able to experience that because
yeah,
right literally in front of our eyes we see this beautiful transformation and it's amazing. I think for artists that do medical work that are not in a medical facility such as myself, it is critical for them just as importantly to have a dedicated space for the nipple tattooing, whether you're in a shop and they have a back room that's for the medical patients, or they have just a complete private studio. That's so important because you don't want to have a woman be uncomfortable and out there, with everything feeling exposed.
yeah.
um
That's the way it was for me. I had a decorative tattoo done by a medical tattoo artist we both know.
yeah.
Um, it was a quiet, clean,
Mhm.
small space, and
Mhm.
that meant a lot to me. What about your planning process with these patients? What's that like for you once they
So
call or get a hold of you?
Oh, sure. So I like to do, I never tattoo anybody that I've never spoken to, right? Because I need to get a good medical history from you and find out a timeline about when your surgeries and things took place. And also it just kind of lets us see, does our personalities jive together? Like, are
Hmm.
you comfortable with me? Am I comfortable with you? Right.
Hmm.
And because again, you have to be comfortable with your artist. So you're going to be spending some time together. So I either do consultations like on the phone and or in Zoom and then or in person consultations. And then we book their appointment. The first hour that we spend together really at the appointment is all of the prep and planning. So size, shape, placement on the breast to balance for the best symmetry, details they want in their nipple, colors they would like. I actively involved every single person that I am tattooing because there's so much of the breast reconstruction process that is not in their control. And this is the stage of the game where they are in control and they need to feel that they are in control because
Hmm.
they have a choice of who they want to be their artist. They can choose anybody that they would like to go to. That's their choice. When you come in and I like to give them freedom to help design and create their special nipple.
Hmm.
Sometimes people bring like preoperative photos in and they say, well, this is my original pair and I have an affinity for this. Can you kind of do something like this? Sometimes that old nipple doesn't translate onto your new breast reconstruction,
Yeah.
but we can use it for inspiration. And that way and sometimes people come in and they're like, oh my gosh, I want something completely different than what I had before. So it's really lovely because there's a choice. And with the unilateral ladies that have a natural breast and one reconstructed breast, then I have something that I can look at and draw and create. And but the prep and the planning is pretty much the same idea.
Yeah.
Balance for symmetry and get a realistic nipple placed on the breast.
Yeah. I'm going to just drop a little suggestion here because when I had my double mastectomy, I wasn't doing what I was doing now. So,
Mm,
like you, Chrissy, I have learned so much since opening Deep Sea Foundation. Um, I'm going to just suggest if you think that you could possibly lose your nipples during a mastectomy, or whether you think you're going to be keeping them, here's the key point. If you're comfortable, take a photo of your breast before your mastectomy.
Absolutely.
I just think it's a good idea for the very reasons that you're talking about. You just don't know. I know my breast surgeon was very clear to me that she was going to do everything she could to spare my nipples. That's a whole nother conversation. We have, we have some information on that too, but in a blog that I wrote, but the key point is here, it's not always guaranteed because of blood source, etc. Once a breast surgeon or a reconstructive surgeon gets into the parenchyma and the breast tissue.
Yep.
So take a picture ahead of time just in
Absolutely.
case. Yeah.
Absolutely.
Yeah.
And because by the time people come to get their nipple tattoos, they are, typically a year or longer out from the time that they had their mastectomy, right? So,
Mhm.
and preoperatively, us as women, we don't sit and investigate and like pick apart our nipples in the mirror like before we would have a mastectomy, right? That's not something that we do. We don't hone in on that kind of like piece of our body. And so by the time people come to me, if they don't have pictures, they usually don't remember what their nipples look like because
Yeah.
they're out of sight, out of mind. They weren't really focused in on them to begin with. And now their partners may remember. So,
Exactly.
right? Like, cause they may remember, but very rarely does the lady actually remember like the color or the shape or the details or all that kind of stuff. And when you get in there with your artist and she starts asking you questions about like, would you like, Montgomery glands? Would you like some wrinkles? Would you like this? Would you like that? And you're showing pictures. It's super anxiety provoking.
Yeah.
And I tattooed my very best friend in the world in 2021. She was diagnosed in 2020, and she shared with me so much insight that probably you wouldn't share with somebody that wasn't like your sister, right, or your best friend.
Hmm.
And one of the things she told me was that she was glad that I took her pictures preoperatively because we used them for inspiration.
Hmm.
And number two is that I kind of gave her a little bit of a heads up about some of the questions I was going to ask and some of the decisions she was going to have to make standing in front of my mirror. And that way, it kind of takes off some of the stress of making those final decisions right there on the spot.
Yeah. Well, and that's where your artistic eye comes in too, because you've done so many, your drawings and everything, you can help walk them through that process if they don't have, pictures previous to their mastectomy. Chrissy,
Absolutely.
I know that you do you have some pictures you want to share with us today? Are you
Yeah.
able? So I just want viewers to know if you are listening to this, I think we will repurpose this for a podcast because there's so much valuable information in it, Chrissy. But on the off chance you're just listening to the podcast, hop over to the Deep Sea Foundation YouTube channel also, and we will have the pictures there. So I will let Chrissy drive here and talk to us about these pictures.
Awesome. Can you see my screen, Terry?
I can. You're just a C now, but that's okay.
Okay.
The pictures are lovely. That's what we wanted to
Awesome.
pull up.
Awesome. So this is a 3D bilateral nipple tattoo example. So this young lady came in and she had a bilateral mastectomy with tissue expanders placed and then implants pre-pectoral, so on top of her pec muscle. And she really wanted just a soft, pink, very natural result. And on the one side of the screen, you can see just after the touch-up and then what she started out with. And then on the other side, you can see what they looked like immediately after the first visit, how they healed when she came in like 10 weeks later, and then what they look like after the touch up. So it kind of gives you a good idea about like what to expect. I typically tell ladies, I try to get you about 85 to 90% completed with your first visit. But however, I have to listen to your skin. So if your skin starts talking to me and saying like, don't touch me anymore, I'm done, then I have to respect your skin and stop. and
Mm-hmm.
not overwork your skin and not hurt you and not damage you. So, there's usually some work to be done on the second appointment, just evening things out between the two sides, adding more details, more realisms, things like that.
Yeah. Okay. So we're looking
So,
at 3D
yeah,
nipple and areola tattoos for breast cancer
yeah.
patients. Yeah.
And then this is a unilateral nipple tattoo. So this patient has her left breast is her natural breast. And
Mm-hmm.
she came in with a right-sided deep flap
Mm-hmm.
and she wanted a 3D nipple tattoo to match. So that's what I did. And
Excellent.
again, with thank you. So I have something to look at, right? And so
Mm-hmm.
it just makes the tattoo process be really great to give you symmetry and balance there.
Mm-hmm. Mm-hmm. Okay.
Um, and then this is a close-up of a 3D nipple tattoo. This patient had bilateral deep flap reconstruction, and we just kind of created. She gave me like artistic, like I don't know what the word is, control maybe, but she
Mm-hmm.
said, just make me a nipple, make me the coolest nipple. Like you do whatever you think is great. And which can be a little bit scary because like I don't want to put something on somebody's body that they don't like, right?
Yeah.
So I did ask her some questions like, do you want this? Do you want that? Do you want this? And we got to create this nipple together and she loves it. And
Mm.
I think it looks pretty good. So
Oh, the detail's
and again,
amazing.
thank you. And her skin is totally flat, right?
Mm-hmm.
So it's all just using principles of light and shadow and trying to create a visual illusion that there's a nipple there when there's not.
Yes.
And then this bilateral nipple tattoos again, just was a little bit of a closer up view there for the nipples. And this is after, actually these are freshly done, looks
Mm-hmm.
like. Yeah,
Mm-hmm.
these are freshly done ones. So usually when the nipples are freshly done, they're a little bit more like pinkish reddish. Sometimes they can have a little bit of an orange undertone. And that's just simply because the redness and irritation from the tattoo process shines right through our nipple colors. If you're tattooing with black ink, you don't see all the redness underneath of it.
Yep.
Um, but we dilute our ink too, and so then that it kind of looks a little bit different. And then as they heal, it just everything kind of calms down, and this beautiful color will evolve, and then they'll be able to see their actual result.
Mm-hmm. Okay. Very good.
Yeah.
So when um, someone, I want to say this from my own perspective. If you are looking at pictures, uh, Instagram is a good place to look for some nipple areola tattoos, even decorative tattoos, okay?
Mhm.
But in the setting of 3D nipple tattoos, which we just saw in the photos you shared, those are flat. I could literally I have a friend that has a 3D tattoo, and you literally can do this to the skin, and it is flat, and there's no projection, and yet it looks like there is. So
Yes.
for the listeners, tune into what Chrissy said here, that you'll want to look at ones that are freshly done because it's a process,
Right.
just like
Absolutely.
a reconstruction. They're a little bit red because you've disrupted those, the skin and everything. That's natural. That's just natural. And then
Yep.
to see the newly healed ones, that's the mark of a beautiful 3D tattoo
Yeah.
artist, which we just
Yeah.
saw. So,
Well, thank you. And I
yeah, what
really
else,
do
Chrissy? Did I
well, I
miss?
encourage no, I encourage people to go onto Instagram or um, artists that you might be kind of looking into getting your tattoos from and look at their gallery on their website. You want to
Yes.
see healed photos, you want to make sure that the artist is putting out work there that they're promising that they can, right?
Yeah. Yeah,
And the best
absolutely.
way to do that is to see those photos. So I really do highly encourage that. And I tell people too, like during the planning process, that's great. Sometimes people will bring me pictures of other artists and they're like, I saw this on Instagram or online or whatever, and I really love this because every single artist has a little bit of a different style, right?
Hmm.
We're all making nipples, but we all have a little bit of a different style. So,
Yeah.
like for instance, I can look at like our mutual friends tattooed nipples online, and I'm like, I know who did that nipple. Like you just know right away.
Yeah.
But so it is great. So bring me examples, bring all of us examples, because as artists, we're very visual learners. So if we have something in front of us and we know you like that, we can help create that.
Yeah. Well, again, I just want to thank you, Christina Johnson Seigel of Living Story Tattoo and the Nipple Fairy. And also, we are going to put resources today. This is important to your information, Chrissy, but also to AMT, the Alliance of Medical Tattooist. I'm going to get that out correctly here. Ask us if you have any questions. Put it in the notes on the YouTube channel or in the podcast, because there's a lot of information to know here about getting a medical tattoo, whether it is a 3D tattoo or a decorative tattoo after your breast cancer treatment and surgery. So thanks for joining me today, my friend. It was really good to see you again.
Oh, well, thank you for having me. You're just so lovely. I miss seeing you all the time.
I,
I'm going
I,
to make a trip out there.
yes, and we know who we're going to go see, our friend Eric I up here in Seattle.
100%. 100%.
Yeah.
I have some I have some ideas worked out for Eric. He doesn't know it yet, but I
Oh,
do.
okay. All right. All right. Either that or I got to get back to Ohio and see you and the gang out there at Midwest Breast.
Oh, that would be awesome. That'd be super awesome.
Thanks for joining me today.
Yeah, well,
Take
thank
care.
you.
Uh-huh.